Now it's Samantha's turn. I think we have this working again.
Okay. I cannot see that very well, so I'm going to look at my little copy right here. I just want to start by saying that Aetna, as an organization, has several years, no different than Blue Cross, I'm sure, in laying the groundwork for value-based contracting and paying for performance versus paying for quality versus just quantity. And we have truly begun to expand the pay for performance and the full continuum of the value-based healthcare system in the models. We currently have 800 value-based contracts in place across the country with 77 ACO models, and that's continuing to grow. As an organization, our glide path, our goal is to have 75% of our costs going through value-based contracts by 2020, and we are currently at 40% of that. In the Houston market specifically, we're closer to around 34, 35%. So we're making progress, but as as Rick mentioned, in our market, it is different. We are a company that does business nationally, but you also have to look at the local level. Healthcare is done at the local level, and you have dynamics that are different in every market. And so we have, I'll walk through just some of ours quickly without kind of being redundant, but we have different models that start at the fee-for-service is how we have been for so long. Pay-for-performance is a model that kind of helps introduce providers into the value-based system. It's available for cardiologists, OB-GYN, orthos, hospitals, primary care, things of that nature, and there are some additional specialties. We have several models that focus on the primary care and the medical team model that centers the care around the whole patient. And you see as it goes up the spectrum, then the engagement continues to grow as well. So we have the patient center medical home, which again is for the primary care, and it's got the advanced care payment and support care coordination, the team kind of care, the team care model. And then this year we're moving into more of the bundled payments as well. It's very limited in its scope right now. I think we're all kind of trying to find our way around that. We have several relationships that we're building on that front. The bundled care will be, it's in the population healthcare management, but like I said, it'll be focused on hips and knees to begin with. We have the ACO, which is some of our most popular. That's where we have most of our membership running right now, and we'll couple that with the high performance network as well. Our ultimate goal is to have more joint ventures in the marketplace, because that's where we ultimately will work with the provider organizations to provide the full spectrum of care for the patients. So just to kind of run through quickly about our models and what they're already doing, they are already making an impact. The ACO, we've had $45 million in savings, and like I mentioned before, those don't look the same in every market. They look very, very different. We work with different plan sponsors and kind of tailor those to fit. We've outperformed the diabetes testing benchmark, 97.8% of the member call. You see the savings there with the pay per performance. That tells you that we are hitting the mark when it comes to paying for performance for providers, because you can pay them for certain measures all day, but if it's not something that they can measure or that they can work with within their office or within their reach, then it's not going to do any good. The attribution, for the ACO attribution models, you see the savings there. The inpatient readmits, the impactable reduction admits have been reduced by 8.1%. The high-tech radiology use down 14.8%. Generic prescribing is up. For the patient center medical home, we have that at 5.3% below other plans. We're able to price those. We're able to price our products based on the expectations of some of these savings and the quality measures that we can get the providers to buy into and show that they can deliver. And we work with them to bring them along. I mean, our goal is to have them where they're able to achieve success in these areas. And so we frequently share information with them. That's those are the only 3 slides that I brought, but I think it's important to note that we have, we're working, I've done network for so many years, but over the past couple of years, we've become a lot more engaged with our sales and marketing folks, and also with our customer service folks. We're trying to look at it as a whole, the patient, the whole patient and their well-being and what it's going to take to bring them around, to help the provider, help the member succeed, help the patient be successful in what they're trying to achieve. Because in the end, we all win. Most recently, I was at a national account, kind of a finalist presentation, and it was really exciting to see them. They had the HR folks come in, and they brought the members in and sat them down, and they were actually incentivizing them with just little giveaway things when they would come in, and they would load on their phone the iTriage, which will help you put in your symptoms, and it'll kind of tell you an appropriate place of care to go. They show the member how to walk through our DocFind. Our tools are work in progress. They always are. I don't know that they'll become static, but hopefully we are, moving in the right direction as far as improving those. Aetna announced today that we have a relationship with, just entered into a relationship with Apple. So we will be working to help subsidize Apple Watches and things of that sort that'll help kind of manage the wellness, kind of help Apple catapult what they want to use the watch for, how they want them to be known in the healthcare, the wellness spectrum, and then also help, on the other end. We have hired he's a former CEO at Harrah's Casino. Because one of the things that Aetna wanted to do is Gary Loveman, he's been with our organization for just over a year now. He's done a really good job in trying to help identify what it is that hits the patient at home. How do you get them engaged? How do you get them to understand that they are in control of their health care, and to get them to want to do better? So what our goal is to work with the providers to help them to understand what it is that we want to do, the measures that we have in place, how we can accomplish those, let them see what we're doing to help engage the patient, what we expect of them to help engage the patient, and then also to get the patient to be responsible as well.
Thank you, Samantha. And when is Blue Cross Blue Shield going to roll out the free Apple Watches for the Frost employees?
Is there a self-interest there? That's a conflict of interest.
Right.